Excellent, thank you. Namani. Hello and welcome. I begin today by acknowledging the traditional owners on the land on which we meet, the Kaurna people, and pay my respects to elders past, present and emerging. We acknowledge their continuing connection to land, sea and community, and we recognise their deep contribution to the health and well-being of all people across generations. My name is Alice Clark and I'm proud to introduce myself as the Engagement Manager at Flinders Foundation. A warm welcome to our distinguished guests, partners, supporters and healthcare professionals, and of course to all those who are living with cancer. Whether you are recently diagnosed, undergoing or beyond treatment, or are a family member or friend who has cared and is caring for their loved one. Thank you all for being here with us today. It's only with the power of our community uniting together that we can make exceptional care and research possible, which we will learn more about today. Before we begin, please take a moment to switch your mobile phones to silent. Toilets are located down the corridor to your left inside the stairwell, and in the unlikely event of an emergency, please follow staff directions. Today's event coincides with the 38th Annual National Cancer Survivor Day, held annually on the first Sunday in June, which was yesterday. Today we come together as a community to acknowledge those who are a survivor, or what they might prefer to say, living with cancer. I'd like to read an abridged description that Tracey Nichols, ENT, Head and Neck Cancer Coordinator and Nurse Practitioner at Flinders Medical Centre, has used to describe the cancer experience, which I'm sure may resonate with many people inside the room. I'm afraid it is cancer. These 5 words in a 30 to 45 minute consultation with a patient are possibly the only words that are really heard. What lays ahead in the minutes, days and months changes a person's life forever. Life, or rather life as you knew it, becomes very different. A new normal, they say. And even the new normal takes quite some time before it resembles anything normal. Coping with everything a cancer diagnosis deals out is tough. The harsh treatment regimes, endless appointments, tubes in every hole, sometimes holes that are especially made, schedules, no saliva, pain, no taste, or rather everything tasting like cardboard. Burns, ulcers, lethargy, depression, illness so you cannot eat, not having food or fluid for days, nausea so intense that even the thought of food initiates dry retching, losing 10 to 20 kilograms in a matter of months, isolation and loneliness because your loved ones can't cope, no job because you can't work, no money, and then having to deal with Centrelink. Then comes the day it all stops, the day the scan is clear, the day you find another new normal, the day you can possibly start to breathe once again. I'm not sure if she's turned up now and in the room at the moment. She will be here later, but thank you, Tracey, for allowing us to share those words. As the number of cancer survivors grows, so too does our responsibility to continue to invest in exceptional care and research initiatives that address the long-term impacts of cancer and its treatment. Because cancer survivorship is more than just surviving. It's about living well and embracing the new normal. Today we'll be lucky enough to hear from some exceptional health professionals and researchers who every day are working together to improve the quality of life of those who are embracing a new normal and who are living with and beyond cancer. Upon completion of this conversation, we invite you to do a tour of our building, the Flinders Centre for Innovation in Cancer, and to stay on for a relaxed afternoon tea generously provided thanks to our sponsors, City of Mitchell. Here's Tracey.
Thank you. Sorry, I'm late.
I'm happy to say that thanks to the support of all of our wonderful sponsors, all costs for this event have been covered. And you would have seen a lovely goodie bag on your chair today, which is for you to take home today. This is full of donated items for you to enhance your own wellbeing. And we're grateful to all of our wonderful sponsors' support who have enabled this. And now it's my pleasure to introduce Karen Hayden, the Head of Development and Partnerships at Flinders Foundation, who will guide us through the next part of our afternoon and facilitate our panel discussion with our esteemed speakers. Please
unpack the notion of survivorship, but in order to do that, I'd like to welcome these outstanding leaders here at Flinders in the field of exceptional care survivorship, whose work spans research, clinical practice and patient-centred innovation. So first, Professor Catherine Paterson. I'm going to read this out because these ladies deserve it to be read out verbatim. So she's a Professor of Cancer Nursing at Flinders University and the Central Adelaide Local Health Network. She co-leads the Cancer Survivorship Research Program and is internationally recognised for her pioneering work in addressing the unmet needs of people affected by cancer. With over 150 peer-reviewed publications and accolades, that includes being ranked among the top 2% of scientists globally. Professor Paterson has developed a nurse-led care models that are transforming survivorship care. She also contributes her leadership across multiple advisory boards and professional networks and is a valued member of the Flinders Foundation Wellness Committee. So please come up and take a seat. Next, we welcome Dr. Katia Ferrar, the Flinders Foundation and Cancer Council Senior Fellow. Oh, this is a long one. Okay. I'm going to start that one again. The Flinders Foundation and Cancer Council Senior Research Fellow in Cancer Wellness at Flinders University. With over 2 decades of clinical experience as a physiotherapist, Dr. Ferrar brings a strong focus on physical activity and its role in chronic diseases and cancer recovery. Her innovative research, including the use of virtual reality to improve the chemotherapy experience, is helping redefine how movement and wellness are integrated into cancer care to enhance the quality of life and long-term outcomes. And joining them is Elsbeth Falster, Cancer Wellness Program Manager here at the Flinders Centre for Innovation in Cancer. Elsbeth has worked in health for over a decade and brings a passion for clinical excellence and community wellbeing to the role. Her work in ensuring that wellness is a vital component of the cancer care journey, and she exemplifies a compassionate, whole-person approach that is central to the mission of the Flinders Foundation. Please join me in welcoming. So, I'm going to start off with Elsbeth, not because you're right there, but because the list says so. So Elsbeth, at the heart of your work is the belief that survivorship is more about than surviving cancer. And as well as we've just heard, it's about living well beyond cancer treatment. It's embracing a new normal. What does survivorship and living well mean in this context?
I think it's really interesting the way that the notion of survivorship has changed over time. For Australians diagnosed with cancer today, they, for many types of cancer, are likely to live far, far longer than they ever would have in the past. I think we're starting to recognise that there is no one mythical day when we go from being in cancer treatment to a survivor. And with that, I think, comes that recognition that survivorship starts right from the day of diagnosis. So every day past diagnosis is another day of survival. And with that, I think, comes the idea that wellness needs to start right at that day after diagnosis as well. We can't wait for a day at which our healing begins. It starts with supporting people right after diagnosis so that they are best supported throughout their entire cancer journey, setting people up really well at first, where it's much, much better for their long-term quality of health and well-being.
So the concept of the day of diagnosis, I think, implies, I guess, to the patient themselves, that Catherine, your work starts before that. So you've led groundbreaking research in cancer survivorship. What are some of the most pressing unmet needs facing survivors today, and how is your work helping to address that?
So I would say I'm incredibly blessed to come from the United Kingdom. So if my Scottish accent didn't give it away, it's certainly gave it away now. But what I would say is what's very clear, unfortunately, is I've worked as a clinical academic nurse. So for the majority of my career, I've worked 4 days clinical, delivering various nurse-led innovative models, and built up my research actually on 1 day. So I wouldn't advocate that model to too many people. But what I would say is, sadly, we still don't get care right for every person at every point. And so one of the quotes that always sticks in my mind from the research that I have done with people and their loved ones affected by cancer, and that's when we're thinking about treatment, we wouldn't run a marathon without training for it. And so a lot of the work in which we're doing now is what's called prehabilitation. Has everyone heard, maybe a show of hands, who've heard of the term prehabilitation before? A few, but not the full. Like, what we really want to see is that everybody's hand actually is up in the air. And so essentially a lot of our work, because we don't always get it right, and it does start at the point of diagnosis, and there's no one size of care that's going to fit everybody, because even for us all in the room today, we're all very different, have different backgrounds, different ages, different family units, a whole list of different attributes that make me as an individual, and you and you and you as an individual. And so what we need to do is to develop a needs-based approach before people start active treatment, and that's what it's called, what means prehabilitation. So often when it comes, as we heard, that profound word of cancer, the shock, we don't retain all the information, but then there's this wait, there's this time wait whereby we've got to wait before we start active treatment. But actually that's an ideal opportunistic time to work together with the person, but not only just the person who's diagnosed with cancer, but also their loved one, because it impacts the whole family. And so what we do is that we do various different types of intervention tailored to the individual. So that involves, as we all know, we're all here together as a village in this room, because it takes a village to deliver excellence in cancer care. And so what we do is that we do what's called a needs-based assessment to identify where are the highest areas of gaps of care. And then what we do is the nurse-led consultations. We work in partnership with the person who's diagnosed, but also most importantly their loved one. And we develop a plan of care, but that also relies on that expert village that I spoke about. So then it requires, for example, that we will bring in the exercise physiologist to get the person physically as fit, but also that dovetails into mental health well-being. We also link in their expert dietitian, so for high-risk cancers such as bladder cancer, for people who may require, for example, radical cystectomies. We optimise nutrition also, as well as ensuring that, and that is one of the big challenges for us, is around the navigation, because we've got private, we've got public, we've got lack of continuity of care sometimes with GPs, so we need to provide that expert prehabilitation models of care up front. But what we've done is that we've done a whole programme of research into prehabilitation for various different cancers, but we're not at the point of service implementation. That's where we need to go from. So we're very clear that prehabilitation can optimise physical and mental health outcomes, and it can save cost into the healthcare system, so it can reduce length of stay, it can reduce post-operative, for example, complications. But the other thing just to say is that the majority of the evidence has been done in the surgical pathway. So we know very little about prehabilitation in radical radiation therapy or immunotherapy or hormone treatment. So that is just to say, I think a little bit about, I think where the greatest impact can come is that we do upfront to embed that not just surviving but thriving as best as we can with cancer-associated treatments.
I think it's great to see not just the depth but the breadth of services that you're actually looking at. It actually goes quite well into the next question. Slightly pre-organised. We actually have a question from an audience member, and it's to you, Katia. It's around, we want to know more about how the practice of sport can help rebuild the body and mind post-treatment. So physical activity is often overlooked in cancer care, although you've just alluded to that it's starting to be looked at more. But what does the evidence tell us about the benefits during and after treatment, and how can we encourage greater uptake?
Sure, great question. First of all, I think I'll probably just explain sport versus physical activity versus exercise, because I think the terms get a bit confused. So physical activity is just movement, and that's actually what we want people to do. Sport and exercise are specific types of movement, obviously, and sport can be for fitness reasons, but also social reasons, and exercise is also another umbrella term for physical activity purposefully for health reasons. So I don't know if I just totally confused you all. Hopefully I clarified that. So let me talk about physical activity in the broader sense first. So what we know from the evidence physical activity is good for just about everyone, and that includes cancer survivors, and that includes people diagnosed with cancer going through active treatment, but also throughout the entire survivorship journey. If we think about during active treatment phases, there's really strong evidence now to suggest that it can help with symptom management that comes with cancer treatment, so things like depression and anxiety, which you can imagine come with diagnosis and the treatment process, but also symptoms like fatigue, which for a lot of cancer survivors is a very common and debilitating symptom that they experience. So we know being more physically active can help manage those symptoms. If we kind of look over the survivorship spectrum, being more physically active reduces your risk of cancer recurrence in a lot of cases and across tumour types, but also reduces your risk of mortality as a result of cancer and all-cause mortality. So it can improve survival rates. So that's a pretty big thing. But we also know that there's evidence now to suggest that being more physically active could hopefully, seems to, in some groups, reduce the onset of peripheral neuropathy, which is also a really major symptom that people struggle with through the cancer journey. It can reduce the severity of those symptoms, and also there's now links to reducing cancer-related cognitive impairment. So across the spectrum, physical activity can be amazingly beneficial for people going through a cancer journey. But please remember that even though the evidence suggests it's basically safe for all of the people in this category as well, you really need to speak to an exercise professional, a physiotherapist or an exercise physiologist or your GP who are trained in oncology to get some advice before you start a program. But as a general rule, across the board, it is safe and effective for all cancer survivors. Now, access to these things? Uptake? Uptake. Okay, so, big question. Maybe you don't have the answers, but some ideas. So I think when we look at the evidence, and that's where as scientists we go first, there is a common theme that comes out when people who are experiencing cancer and their caregivers have a chance to communicate, and that's that more support from their family and friends and more support from their treating oncologists or clinicians about physical activity would actually improve their participation rates, and we see a relationship there. And so I think, I suppose a reasonably easy target then would be to support our clinicians who work in this space and to provide some education so they feel more confident in discussing physical activity with cancer survivors, when they get the opportunity during consultations. But also more maybe accessible information and resources for cancer survivors themselves and their loved ones, so that they also understand the benefits of physical activity. And I think that also sort of taps into an opportunity for us to clarify. Like I said, there's a bit of confusion out there about, is it exercise? Do I have to go to the gym? Do I have to lift weights to get these kind of benefits? And I think sometimes that can scare people. And so I think it's a chance for us to also simplify the message. And like I said, we just want people to move. And that can actually be washing the dog. And I've got big dogs, so that's reasonably hard work. Or there's been a recent study lately, not necessarily in a cancer population, but it showed people dancing for 5 minutes, like you would to the radio, can actually have health benefit effects. So physical activity is that whole spectrum of moving. And I think the final thing is we probably need to communicate that it's really important for you to enjoy. We know that if people enjoy physical activity, they're more likely to do it in the future. And I know that sounds really intuitive, but I think some of the interventions maybe aren't enjoyable or modifiable so that everyone involved in them really enjoys it. So I think that's the other thing that might improve uptake if we can just get that message out there.
Sounds like an EOI to the Flinders Foundation.
So clean back to you, Catherine. We've just sort of heard an example in the physical space. Can you share an example of a real-world solution called nurse-led model that has been implemented here at Flinders, which has significantly improved some outcomes for cancer survivors?
Yeah, so I think one of the major things as I say that So what we do is that we implement what's called this holistic, maybe if I could see a show of hands, do people know when we speak about a holistic needs assessment, what we're meaning in the room? So not everybody, a few hands going up, and actually this is a really important message, and if there are people who are going through this cancer experience in the room with us, it's certainly something that you can ask your healthcare provider to conduct with you. So a holistic needs assessment is essentially checking in with what areas of life are concerning to you. So we know that life gets in the way without cancer, and people throughout their lives at some point, I think the stats is almost about 90% at some point or other will require some form of mental health support over the course of their trajectory of their life. So with a holistic needs assessment, essentially what we do is that we have our patients and their loved ones complete a checklist that covers holistic domains of life. So that includes psychological well-being, so anxiety and depression. It includes symptoms, so thinking about symptom burden. It also includes things around spiritual well-being, family-related concerns, information support, so it truly is a full holistic assessment. And then going into that consultation with the healthcare professional, so in my situation is coming in as a nurse practitioner, then what we do is we tactfully use that information to tailor the consultation to address the areas of most concern. So of course during that meeting within the cancer follow-up experience, of course we have to very carefully monitor response to treatments and observe for any recurrences, but what we need to do is to come up with a shared care plan together in partnership. And so that's the only way that we'll be able to deliver exceptional care, is to ensure that the care is tailored in partnership and it's individualised. So over the course of my clinical academic career, I've done various different level 1, what we call level 1 systematic reviews, and that's just a term that means we very meticulously pull together all known evidence on a particular topic or question. And so what we know is that over time, because none of us are the same over time, and so of course it's not, and when I'm saying this, it's not rocket science, it's important fundamentals of care, of ensuring that we're getting it right at every point and every follow-up trajectory. And so I would really encourage everyone who, as I say, that would be a really important message for me, for you all, is to think about having that holistic assessment and targeted interventions, because that then allows us to pull together, as I mentioned, this village to deliver excellence in care. So that does touch upon whether we do need to bring in our expert physios or our exercise physiologists. But I would say that's one of the models of care here at Flinders, to allow us to deliver that exceptional care, that it's moving beyond that very traditional medical follow-up whereby we go into the consultation, our clinician provider may say to us, how are you? Oh, I'm okay, but actually we've got all of these problems that, one, we don't have time to discuss, or two, sometimes there's not that opportunity that people and their loved ones can feel confident, particularly if it's for things, around relationships or intimacy that sometimes our treatments can play havoc with. So it's just to say, I think it allows patients to be in some ways in the driver's seat, so they can then guide that consultation to the areas that are most important. So that's maybe one example. And maybe if I touch on another example, is around capturing real-time holistic assessments when patients are at home in the community. So we know sometimes, that when patients are undergoing that treatment and follow-up, there's this space where people are unsupervised, if you like, not supervised, but they're in the community and they may not feel that they've got a rapid access to come back up to the hospital to receive advice, clarification, guidance, tailored information. So we have moved this model of the checklist in person into a remote digital support in the community, so whereby patients complete the holistic assessment, and depending upon what they say are their concerns, they are then delivered in real time in a digital platform tailored self-care advice. Because we know very often we're very good in saying these are the potential consequences of treatment, but actually what we really want to do is to be supporting people to alleviate those symptoms and to use the strategies that can alleviate whatever sequelae it is. So it's just a couple of examples of face-to-face holistic assessment and shared self-management care plans, but then transitioning that into the community as well.
Yeah, I really love that notion of talking about the village, and I think that probably speaks to this centre. It's almost like this is the town square, and you know, all the services get to come together, and that's the beauty of a place like this. So, Elsbeth, as part of one of the village members, can you share how research and the concept of survivorship can be applied and integrated as a best practice through the wellness centre here?
Yeah, I think we've just heard some really amazing things which immediately make sense. And I think quite often we hear some wonderful research and we think, that's great, let's do it. And unfortunately, in reality, we know quite often, especially in the health sphere, this amazing, fantastic research that everyone should know about it is done and then published and kind of hangs around there in space until someone is able to implement it. So I think that this is such a remarkable centre in that we have researchers and clinicians working alongside each other. We have researchers who are clinicians, clinicians who are researchers, but also we all share the same lunchroom, for example. So that kind of cross-pollination of ideas is really, really valuable in itself. And one thing that then just takes that to the next level is having a space where we can have our patients involved as well. So in having the wellness centre here, one of the hopes is that that provides a real conduit for our patients and families and carers and members of the community to be able to ask those questions and for them to find their way to researchers. And we hope that we can build a place here in the Centre for Innovation in Cancer where those research findings are able to be implemented far more quickly, partially because those people who have been involved in that research are on site or very close nearby within the precinct and able to perhaps make suggestions about how that can look. So I think when we talk about research translation, i.e. taking those wonderful ideas and putting them into practice, I think we are in such a privileged place in the Flinders precinct to actually do that, and I think this building specifically is a place where I hope that we see that really happen.
So we've talked a little bit about wellness, but I want to sort of shift into the notions of well-being, and Katia, to you. So you've pioneered using virtual reality in treatment settings. Can you tell us more about this innovation in enhancing the experience and recovery of patients?
Sure. So I'm leading a project with an amazing team of people and experts to explore the use of virtual reality and sitting pedal exercise while people are sitting in their chemotherapy chair having their chemotherapy infusion. And so this came about from the notion that the evidence suggests that virtual reality exercise is more enjoyable than the same exercise without the virtual reality experience. So remember I said enjoyment is really important for participation, so we're tapping into that. And that we also know that people are sitting in a chemotherapy chair for a long time, and so it's a perfect opportunity to provide some supportive care intervention, if they're interested, of course. And so I will also give a shout out to the virtual reality experts who are on this team, and they're View Reality Labs from Singapore, and without their help this wouldn't be happening at all. But there's a few people in the room who are part of this team with me, either as investigators, and so we've got investigators from the infusion suite as well, and we've been talking to cancer survivors who have either had chemotherapy in the past, and then another group who are currently going through chemotherapy. And we're also talking to staff and the amazing staff from the infusion suite here in the building to get their feedback and ideas about what this virtual reality exercise experience should look like. So for the cancer survivors, we're asking them what their virtual reality world they want it to look like, so as they pedal, what they want to see as they move through this environment. And then we're also asking them sort of logistical or perhaps barriers that they can potentially identify, and we're using that rich information also from the staff, because obviously the staff in the infusion suite are going to be the amazing people to help deliver this intervention. So we are still in the development phase. It is happening. So I can't tell you exactly what the outcomes are yet, but we have spoken to our cancer survivor participants who are currently going through chemo and past, and they've identified what they think would be the benefits. All of them said they'd want to try it if they were in the infusion suite, so that's a really good start. Then they said things like distraction from the really sort of stressful environment that for some people that's their experience of the chemotherapy suite. It can be quite noisy and those kinds of things, so they said it would just take me away, take me to another place. They comments like it would give me a sense of control in an environment where I don't feel I've got control, which is also a really powerful thing. And then also doing something positive, which is also a really wonderful thing. And so that's what our groups of people have told us. And so that is actually even on top of the benefit that we are hoping that they will potentially get a positive physical activity experience, and then hopefully we might then see physical activity levels maintained during chemotherapy, or possibly even increased, because we know as a general rule they usually decrease during chemotherapy. So when we do get to testing, we're going to look at those benefits that our consumer group have identified, the psychological and the emotional benefits, but we'll also look at those sort of physical activity benefits as well when we test it. So stay tuned. I will let you know what we find.
I'm kind of keen to try it out. So one of the notions you also talked about then was about co-design to a degree, and I'd like to refer back to Catherine on this one. So in your world, how can survivors and carers be meaningfully involved in co-designing research and services that impact the recovery and long-term from a wellbeing perspective?
Oh, great question, and such an important question as well. What I can say is certainly across our Cancer Survivorship Programme, we work actively in partnership with all our consumers to inform what the research looks like. So one example, which I've had such a pleasure and delight of actually working with a group of consumers around a concept they had, and it's called a Care Connect notebook. Because of these issues that we've touched upon around sometimes a lack of continuity of care follow-up in appointments, sometimes not knowing the right questions to ask, then when you come to the clinic, your mind goes blank and you forgot. And so this was a purely consumer-led notion, and it underwent a lot of consultation, and is going on to be digital, but it's also a paper-based little notebook that's just small enough. Even it was around thinking about the design of the consumers, that they didn't want it at A4, they wanted it a smaller size that could just slip into the handbag or in the back of a man's pocket or wherever it may be. But it provides an opportunity to have an ongoing understanding that brings that control back to the person and your loved one with cancer around what is my plan of care, what are the important questions that I want to ask, and what is my plan in terms of next steps, as well as having a list of helpful resources at the back. And so this was, as I say, one example, but we do this across the whole programme. But it's something that's new in terms of the next part, which has been so inspiring to me, because they then have said, and it was their words, and I'm always, I think in Scotland, like sometimes the concept of those, if you heard about a thing called shut up and write, it's an academic term, but when I came over to Australia, I thought, oh, that sounds very good to me. Like, and so the consumers who we've been working with knew about this term, shut up and write, and so I'll be working proactively with them as authors in a section of writing up the manuscript for publication to share this beautiful work around Care Connect. And as I say, that's one beautiful example of truly working in partnership, because as nurses and doctors and allied health and experts leading in our beautiful cancer centre here, I personally have not had cancer, so I can always advise from the best available evidence and from clinical insight and my particular area of expertise. But for people going through that journey, they're the experts because it's them who are going through this journey. And so we need to proactively work with our consumers to inform what the priorities are, but also aligning those priorities to our South Australian Cancer Plan, but also our National Australian Plan as well. But I do think certainly the beauty here at the Flinders Cancer Precinct is that all of our researchers are clinically based, because that's where the innovation and we can inform if we're applying, the money and we rely on support from our community. It means that the research has that impact of getting back to bedside or back into the clinics, and you can't do that together without working so closely. And so I just wanted to bring that home, that sometimes when we think about research, we can think about this ivory tower sitting in the university somewhere, and that those impacts never get to where it's needed most. But that's a particular strength for our Flinders family community here. So that was just one example of a consumer initiative that this will be the first time for me for doing a Shut Up and Night session led by the consumers, which is truly wonderful.
We look forward to share that, I'm sure. So I obviously want to add everything to card about what you're talking about, and understand that you talked about translation is a lot more accessible here, but I appreciate there are still some barriers. So Katia, to you, what barriers still exist for cancer survivors in accessing exercise and wellness programs, and how can we overcome them, especially in particular?
Again, big questions.
Sorry.
Some ideas, maybe not answers, but ideas. I think if we're talking about sort of organised, structured programs, whether it be physical activity or other types of wellness programs, consistently, and you can all imagine yourselves, what are your barriers getting to your knitting class, gym, book reading, poetry, whatever it might be? Time, cost, is there one in your area, so location, and is it suitable for you? So they're kind of big ones, and we see that consistently, regardless of what the programs and the initiatives are. And so you can imagine in the cancer survivor context, it also needs to be suitable for you. So if we think back about maybe a physical activity program, that person needs to feel that their health status is appropriate to join that group as well. Or even beyond cancer survivorship, the individual may have a disability, and therefore they need to work out whether it's acceptable and suitable for them, or they may speak a different language other than English as their first language. So do they find that group suitable for them? So these are big barriers to overcome, and you can imagine then those, if you think about through some of those people who are living in rural and remote areas, of access, there might not be experts in their location to provide those kind of services that they find acceptable and suitable for them. And then also, as you mentioned, other underserved communities, like those living with a disability, or like I said, speaking another language. So those barriers are sort of amplified in those other groups. So how do we overcome those barriers? We keep trying. I think we need to think, we need programs out there in the community, so that particularly when cancer survivors have maybe finished their hospital-based interventions, they have more support after that kind of more structured support has ended. But to do that, we need programs to kind of be sustainable and low cost, and not need, I suppose, huge amounts of funding to get off the ground. And I think for me, as a clinician and as a researcher, also to keep them running. There's nothing worse than having a program that runs for a short time and then disappears again. We've seen it in all of our parts of our lives, haven't we? So maybe we just need to think outside the box a bit. I've been involved in the past with lots of student-led clinics, and I think that's actually one really amazing opportunity to provide survivorship and supportive care services delivered by our allied health or medical or our nursing students, who all have to do clinical hours and all have to be part of research programs. And so it ends up being a win-win, because then we get low-cost, sustainable programs run in the community or even in a hospital setting. And then we're teaching the healthcare professionals of the future, and we're educating them about oncology and survivorship care. So to me, I think that's, you know, a potential model. But I just think we need to think outside the box a bit from perhaps what our normal ideas and programs are. We also need to consider probably digital health and telehealth, particularly for rural and remote communities where it's appropriate. You know, for some age groups, for some people, they might not find that appealing. Some really remote areas actually really struggle with internet access. But I think COVID has done one good thing for healthcare, and it has opened up the opportunities and made telehealth and digital health probably a more acceptable delivery format. So I think, you know, we could tap into that a lot more. But also circling back to what Catherine was talking about, the importance of co-design, if we don't have programs that don't meet the needs of the people that they're meant to be delivered to, people will not go to them and access them. There will be a barrier because they don't find them acceptable or appropriate. So all of the programs we design should have a co-design and a consultation process throughout the entirety, you know, of the actual kind of development phase and the delivery phase and the evaluation phase of it. And then I think then we'll probably get closer to delivering programs that people want and will use and keep using to help their lives better.
You've answered that and the next question, so well done. So I guess you started to go into, you know, what is at a systems level, and I'm going to direct this to you, Catherine. Given the increasing number of survivors, what are the critical policy or research investments needed now to prepare for the future survivorship care demands?
So I think a tricky question, and it's a challenge, I think, for all healthcare systems actually around the world. But I do think investing in models of rehabilitation up front, ensuring that people have the resources to navigate what is available in the community, is critically important. So one of the major things in bringing it home for us in Australia, our team at Flinders had led the consultation and evidence-informed plan for the South Australian navigation plan that was also informed from the Australian-wide plan. And so the reason why it's so pivotal, and I'm saying this from a clinical experiential point of view of coming from the UK, it is a complicated system, but what we have in Australia is some of the best cancer outcomes in the world, actually. But where it can become quite challenging in thinking about how do we provide that exceptional care for everybody going forward in the next 10 to 15 years, it does require getting care safely transitioned where possible and where safe, to allow patients to be safely monitored in the community setting, because our hospitals are increasing with numbers because we are getting much better, thanks be to God, around treating cancers. But also what we need to do is ensure that what we're doing is providing that opportunity for people to thrive, so not just to survive. And that includes when we think about models of geriatric oncology, so providing tailored support and models of care for older people, so they say over 65 years of age, but also thinking about our little tots. So even all the way through, I have one of my PhD students is looking at the supportive care needs of expectant mothers diagnosed with cancer. And so they're trying to navigate obstetrics plus cancer. And so it's about how do we deliver care that is interprofessional. So we're coming together with shared goals of care, I think, is really, really important. But I think the thing really to overcome, because we have such a wealth of different services afforded to us, we can be treated in private or we can be treated in the public system. We can be followed up in the community, but the main thing is trying to integrate that care together. So what we do have, which we're very, very fortunate is our South Australian Comprehensive Cancer Network. So you may be aware of that. So I sit on the interim exec of that group, and so we have had the investment from the government for 77 million for us in South Australia to get this right. And so one of the key things for us is ensuring that we overcome navigation issues for people. But I do believe that if we get it right up front, it's not to say that we don't continue. So a lot of the work, for example, I've touched on prehabilitation, but also there's a really important aspect of rehabilitation. So we need to ensure that the care provides that prehabilitation, but it's seamless, and then it moves into the rehabilitation for people as well. I think there's going to be a continual movement around the role that artificial intelligence might have. And so some of the work of what we're doing in our Cancer Survivorship Programme is working with AI experts to use big data and appropriately risk stratify people who need to continue with follow-up. So one example of thinking around how we can do that, I think, is ensuring that all healthcare professionals are equipped to work to the full capabilities of their practice. So one of them, for example, in the nurse practitioner space, which I find really interesting coming from the UK, is around restrictions in certain prescribing, for example. But that means then if we took away those restrictions, which we don't have in the United Kingdom, for example, it means that the full expert team can come together, and it means that one comprehensive appointment for patients avoids 3 appointments. So I think it's thinking about maximising the full workforce available to ensure that we are delivering that exceptional care. But the other thing is that I think there is an important role for digital follow-up, and there, for some people, and I've seen it in my area of practice, which is GU cancers, and I've done a lot of work, particularly in prostate cancer, is that we can have gentlemen coming back with their loved ones. You know, it could be in Scotland, it's the remote and rural islands where they fly in an aeroplane actually and fly out again, but more so for us in Australia, thinking about the vast geographical distances of remote and rural. And so one of the models of care that we developed was what's called a virtual model of care. So for men whereby they are stable, they don't have any unmet supportive care needs, we can safely keep them monitored in terms of monitoring for cancer recurrence, but they have a rapid access to come back into the hospital if they need to. So I think whilst our GPs have a really important role to play, they do such a wonderful job, because cancer is one condition, but they look after so many different conditions and across the entire lifespan. I think it's ensuring that we do bring the GPs in into shared models of care, and that's some of the trials of what we're doing in our current programme, such as MOSES, which is a shared care prostate cancer model that we're testing. So I think, to answer the question, I know I've touched on multiple different prongs, is because I think it's going to require that. I think it'll require, the main priorities is making sure that the workforce is able to work to the full expertise of capabilities. But then I also think there's an important role of transition care, but ensuring across that entire lifespan that we are providing evidence-informed risk stratification. So for people who can be safely monitored in the community, we have a rapid access coming back if they need to, but also we ensure that everybody has that holistic needs assessment, because it's pivotal, I think, to ensuring optimal quality of life outcomes.
Really interesting about that idea of shared care, and it wasn't just because your accent said it so beautifully. Every time you said it, I'm like, yes, beautiful. But I think that that's really, I think we talked about it before, and even Elsbeth and I were having a conversation today, a couple of days ago, about the cogs in the machine, and that this building in itself gets to be an example of that shared journey, and perhaps there's more that can be done, you know, not just within this building, but through to the GPs and even onto the students coming through, what that journey looks like. So as we sort of finalise, I would love to know, looking ahead from Flinders Foundation perspective, what is investing into exceptional patient care as a means of supporting survivorship look like? So that's for you, Elsbeth.
I think that's a really interesting one. We've touched on quite a few aspects of it, but I think the Flinders Foundation model in funding both research and our patient journey is really the only way to go. I think that is just the way to deliver. Our research informs our practice, and then our practice asks those questions which we need of the research. So to have an organisation like the Flinders Foundation supporting both, I think is really is critical to the cancer management and navigation going going forwards. I may be a little biased, but I'd say that the support from the Flinders Foundation for a wellness centre is just showing a real commitment to wellness, and that takes quite a big step outside perhaps a traditional understanding of what excellent care looks like, or it's another approach to it. So sometimes it's something which doesn't have as much evidence, for example, but it's something that is really identified as being necessary for people's survival and people's quality of life into the future. So I think that approach to research and just extraordinary medical care, with then that overlay of the really, really individualised care for patients. So wellness is something that is a little bit of a tricky one because it is so personal to everyone, where of course everyone needs their most basic needs met. We need a roof over our heads, we need great medical care, we need to be able to eat, we need to be able to sleep, we need interactions with the people and the environment around us. But then that experience beyond that is so personalised. Looking at things like purpose and values and spirituality, creativity, they are all part of our wellness. And for that to be recognised in a centre like Flinders, and for the Flinders Foundation to support that, I really think that that's just going to make a world of difference to patient care. And I hope it's something that leads the way for other centres around the country as well.
Excuse me, will there be time for questions, please?
Oh, it's like I planted you before as well, because the next bit is, seeing as I got engrossed in the minds of these wonderful humans, I just want to check from a time perspective.
Yeah, we've got 5 minutes.
We've got 5 minutes, so I'm assuming because you've asked that question, you're not using that as your only question, you would like another? I'll give you another one.
I would like,
Here we go, I'll pass this on.
yes, well, thank you very much for inviting us here, and there are other aspects which I think are very important, probably equally or even more important than some of the things that have been discussed. And what I would like to see, for example, is a short dissertation on the enormous improvements which have happened in the treatment in medicine generally, but specifically in cancer. Now, breast cancer is a marvellous example, going back to the time of Elsbeth, the famous American surgeon, who, of course, advocated total mastectomy. And when I graduated, that was the treatment of cancer. And it seemed to be very sensibly based on pathology, because breast cancer does spread to the axillary lymph nodes. I don't want to get into technical issues here, but it was realised later that simple mastectomy gave the same results, enormous improvement for the woman's well-being and self-esteem. So this is just one example. I don't know what people would like to hear, but I feel that that would be an excellent topic to discuss at a future meeting.
Great. Would anyone else like to ask any questions?
More of a bit of a statement and a few questions. So I've had a very complex cancer journey, and I call it the safari because there's a number of things involved. But throughout the time, the coordination of all costs of cancer, be it emotional, financial, your appointment diary that was meant to start out as a journal, that then goes complex. But I call it, which lane are you in? So if I'm speaking to someone, I don't know if they're originally, from Allied Health or my palliative care or my GP or my oncologist, so it's just determining where everyone is before you get the information. And the beautiful lovely people in every team that deliver, of course, after your welfare and information. But I find that that's the cobweb effect for coordination to happen. It will be amazing because that's where it's got to be centralised, and of course with AI and technology updates will be easier for access. Once you sign that form, of course everybody can have access to everything about me. Will be fine. So it's absolutely beautiful that everyone's on the same page. But with a time frame perspective, that was probably my question around that central coordination would be good to know. The other thing is with a cost of cancer is the timing of finding out when you are shocked. So you're shocked about finding out you have cancer, and then, and I'll probably afterwards bring up for a conversation if that's okay. I've had the advantage of going through private and public for cancer journeys, and one of them is that with a private health company, they don't pay the Medicare gap for radiotherapy, which is not a clinical trial, it's your standard cancer update, and to find that out for that particular time is a huge shock. But I'll go through with what's happening with that because I'm on my soapbox about that one. Well and truly. It also then goes back to the coordination of all of the finance details that you will need to find out at the earlier stage will be amazing, because I find bureaucratic admin side to cancer and stresses around that take over a lot when everyone says don't be stressed, relax, and it's like, I'm sorry, we have life and cancer at the same time. So that awareness would be amazing. So I hope that's not too garbled because my delivery was not prepared. But thank you.
So I'm guessing that the question in there is probably directed around, I guess, that coordination and almost a bit around information and that first journey and how you can inform patients, not just about, I guess, the physical surviving and living well, but the actual life components of living well, like logistics, finances, all of that stuff, which probably aren't on top of your mind because you're thinking about your health, but critical factor in living well and surviving. Did you want to?
Just an information sheet. Like when I had my surgery, it's what happens next, and you just find out different things as you go along. Whereas if I had an information brochure, who to contact, where to contact, other than the Cancer Council, like the Flinders, doctors, physios, everything. So you've got names, addresses, people you can contact when you feel like contacting them. But at the first and the beginning of your treatment, or after you've had your operations, so you've got something that you can go to directly and follow along a little path instead of, oh, I found out 6 months ago I can go to a health centre, or I need to go to a health centre. Flinders has one here that I can go to, but I didn't find out till a lot later. So that information up front would have been fantastic.
Katia, looks like you can.
Yeah, can I just add to that? So I'm also part of a project at the moment, almost helping with that kind of process, working with Associate Professor George Berto here at Flinders Medical Centre in the pancreatic and biliary surgical unit. And Catherine is also part of our wonderful investigator team, if you like. And that was exactly the thing that was identified by pancreatic cancer survivor that we spoke to in particular, the need for information at the right time and the need to be directed to the right services at the right time. So it sounds again like a really simple thing, but and Catherine can speak to this more, but that's exactly what this holistic needs assessment concept is about, that actually sort of almost screening or asking people like yourself as you go through, what's troubling you at the moment, what do you need help with, here's the information we can give you for that, we'll direct you to the right place. starts the conversation, and it opens the door for that kind of appropriate and timely service delivery and information giving that we know actually improves the quality of life of cancer survivors, but also their caregivers, to reduce the burden, especially even just finding information. So.
I don't really know much more to add, but also just circling back to your comment that you made initially, I think that's a wonderful idea, is to have the celebration of all the wonderful successes that we have absolutely had and how we manage cancer. But the main thing is, I think, also what we need to be doing is getting it right at the very onset. And so certainly even for me as a clinician in the clinics, I can see it, that people, and that's why I'm saying, and I'm not meaning to disregard the work of what we're doing, but these are fundamental elements of care that as healthcare professionals we should be able to get right. And it's the system actually that can make it complicated, because we don't have one universal system. For example, in the NHS, which we did, everything was coordinated all the way through. So for example, when the patients were referred with prostate cancer, it came up to the nurse-led assessment, and I was trained, the urologist surgeons had trained me to do the prostate biopsies under ultrasound guidance. I then followed through all the patients to come to the expert MDT meeting. They all came back to see me for that continuity of care 2 weeks post MDT meeting, and they had me and my relative colleagues all the way throughout. So it provided, even going into survivorship clinics, all the way through up until the point of advanced prostate cancer. So it's that coordination that brings it together. But and that's why we've got the South Australian Comprehensive Cancer Network. So this investment is our opportunity to get it right. And so we do have a group of clinicians and researchers, multidisciplinary, of our professors in oncology, surgery, nursing and allied health and others coming together to, because that's the wicked problem, I would say. And it's not a problem that we're not able to solve. We can absolutely solve it. And I think with the resource, I think we're in a very exciting time to be here in South Australia. So just to acknowledge both of those wonderful comments, and tailoring that tailored information is so important, so people can feel in control and they know what's coming. Because as I say, maybe to finish with this comment, we wouldn't run a marathon without training, albeit I did for cancer. I raised $18,000 and I only had 3 months, which wasn't the smartest thing to do, but I did it. But just to say, it's the same thing. We need to prepare people for what is ahead. Yeah, thank you.
I think it's, you kind of touched on everything there, and it's that whole journey around, as you said, from day dot, and we alluded to before, but you're working on it before that happens, and thinking about those patients before those patients are even patients. I'm just really thankful to the whole panel today for sharing your expertise, your insights, and I guess for the daily passion that you put into your work, and the contribution that you make to this community, to this foundation. And yeah, we're really thankful, and I hope somebody took notes, because there were so much beautiful things that came out of that, but I'm sure they did. But I just wanted to thank them all, and I think we should give them a round of applause. Maybe take seats again, I don't know, as we close up.
Hello. We are just over time now, 3 o'clock. Our next part of the event was to invite Ross to come up to have a couple of words. Lovely, thank you. Allow me to introduce you to Ross Verschoor, our Executive Director of the Flinders Foundation, for a couple of minutes.
It's a bit scary seeing a photo of me big up there. Just going to bring my phone up because I wanted to refer to something that I read earlier this morning. Firstly, thank you to everyone for coming today. It's great to see a big turnout, and a room full of clinicians and researchers and donors, and people living with cancer and family members, and that's truly what it takes, this collective effort to make things better. I know that wellness is not all about exercise, and just today, I'm sure you're aware of this, Catherine, a good friend of ours, Matthew Wallen, who's an exercise physiologist in the survivorship team here. And at Flinders Foundation, we're so blessed to work with some of the best clinicians and researchers. They really are doing life-changing and life-saving work. but there were key findings from a structured exercise program for colon cancer survivors following chemotherapy. And key findings, and I'm not a scientist, so please don't call me out on any of this, is that 28% decrease in risk of disease recurrence, a 37% in risk of death from any cause, improved physical functioning and cardiorespiratory fitness, and sustained increase in moderate to vigorous physical activity from that study. And I think the follow-up time was somewhere around 8 years. Now, if we think about all of the pharmaceutical investment in cancer treatment and improvement in outcomes for people affected by cancer, and if we looked at exercise as one intervention, you can just see the impact of that alone, and maybe we should start thinking differently about prescribing exercise as a part of a cancer treatment plan. And again, not a scientist, not a physician, but please speak to your care team about that and consider incorporating it into your program or the program of your loved ones. For those of you who've been supporting us and attended functions in the past, you might have noticed something's a little bit different about Flinders Foundation, and I know that's really small, but it says exceptional care without exceptions. And when the foundation established this building in 2012, it was our biggest achievement to date. Still is the state's only integrated cancer centre in South Australia. I mean, that now still stands. I think it always did, we just could never articulate it. So we believe that everyone deserves exceptional care and that there should be no exceptions to that. And everything that I've heard today speaks to that. The medical team here do an outstanding job, but we believe that we can do better for you and your families. And we want to wrap that care around you and your families, and we want it to be exceptional. And we don't think there should be any exceptions to it, no matter where you live, no matter what cancer you've got, no matter what your social disadvantage might be. So that's what the foundation stands for. And we thank you for your support. We have established the Cancer Wellness Centre here, and Elsbeth is new to the team, but she's going to be leading the program with support from an expert committee. But we also can't do that without community support. So our role is to rally support from the community and invest it into programs, life-changing and life-saving programs, research programs, service delivery programs that can really deliver exceptional care to you and your families. So please consider supporting Flinders Foundation, knowing that that's where those funds go. I believe we're running a little over time, so I'll cut it short, but I'll be a part of offering a bit of a tour soon. So if anyone wants to walk through the building, happy to talk to you more individually or as a group then. And thanks again for your attendance today.
I will wrap up now. We will be embarking on that guided tour in about 15 minutes, so please have some tea, coffee and afternoon tea refreshments either before or come back and join us again and have a cup of tea. There will be some beautiful music that I just wanted to shout out to the Flinders University medical students and the Arts and Health program, which will be playing out in the foyer, so please do enjoy that music. We would also love for you to pick a ribbon and write a message of support out to tie on our wishing tree if you are inspired to do so. Lastly, I'd like to make you aware of an opportunity to rejoin us here at Flinders on the 27th of July as we recognise World Head and Neck Cancer Day, which is an opportunity to raise awareness about head and neck cancer, and there will be complimentary screening and education sessions taking place there. But on behalf of the entire Flinders Foundation team, thank you again for being part of today's event and for your transformational gifts and wonderful donations and support that continues to drive the Flinders
27th of
Foundation.
July is World Head and Neck Cancer Day, but we'll offer the free screening on the 23rd in this building here for anyone that's passing by.
Thank you so much, Tracey. I always had in my head it was the 27th, so good for you to make that
27th is
mention.
World
Yeah.
Head and Neck Cancer Day.
Beautiful,
We'll be
but
on the 23rd.
don't come on the 27th. But you can come anytime.
Come anytime.
I'll wrap up there now. So thank you so much, everyone, for attending.